Hello guys, welcome back to my channel. My name is Divya. I am CPC certified medical coder. As I previously discussed, we will cover the tendon repair topic in the next video. So today we'll continue our next video, next topic, that is a tendon repair topic from the musculoskeletal system. So let's get started. So we previously discussed tendon origin injection and the plantar fasciotomy. So today we'll cover the tendon repair topic. So tendon repair. So why we need to tendon repair topic? What is the need of tendon repair? Why we need to tendon repair? So basically, as we previously discussed, what is tendon? Tendon is an connective tissue that attaches that connects the bone to muscle. Here is a muscle you can see in the pic, and here is a bone. So the connecting the bone to muscle structure is known as tendon. So if there is an injury or there is a problem in that tendon, or sometimes the tendon get ruptured, or there will be a tear in the tendon due to some issue or problem, then that need to be repaired. So basically when this rupture or there is an some the patient will feel pain, or there will be a movement loss in the uh, body in that tendon where is present. So uh, basically tendon repair is a surgical procedure to fix the torn or the damaged tendon that connects the muscle to bone connection, that is known as tendon. So if there is rupture in the tendon, then tendon needs to be repaired. So common sites of the tendons like the hand, flexor extensor, shoulder, rotator cuff, Achilles tendon, and the knee. So what is Achilles tendon? So this is an strongest or thickest tendon in our body that connects the heel to the calf muscle. Here it is an leg and here is an foot. So in the leg there is an calf muscle, and here is an calcaneal bone which is present in our heel. So between these two, that is an connecting, that is a tendon connecting. So Achilles tendon is present between the heel bone and the calf muscle. Okay, and what is rotator cuff? Rotator cuff area is shoulder. So basically rotator cuff is a group of four muscles, where the four muscles are, what is the four muscle? So four muscles are supraspinatus, infraspinatus, teres minor, and the subcapsularis. So so they're all tendons connectively makes a rotator cuff. Okay. So if there is a rupture in that their tendon, then it need to be repaired. Coming to next. So before going to tendon repair, what physician will do in the tendon repair? How the tendon repair happen? What physician will do? Basically, physician will assess that injury. For example, like MRI or clinical examination will be there. So he will assess the injury and decided which type of repair will be there, where it is an tendon graft, tendon transfer, or primary tendon repair. And after that, identify the ends of the torn tendon. For example, here you can see in that pic, here is a leg, the tendon breaks. So their ends need to be, he will identify the ends of the torn tendon, and after that he will align that suturing will be done to restore the movement, and the cast and splint will be applied, and after that rehabilitation or the physiotherapy will be done. So basically simple, physician will assess the injury, find the types of repair, identify the ends of the tendon torn, and alignment will be done by suturing, and cast or splints has been done, and rehabilitation and physiotherapy will be done. How it's happened, how it's done? So basically physician will give anesthesia to the patient. Okay, after that he will incise that area. Okay, so he will cut the skin to expose the tendon. So tendon identification. After the tendon identification, what will physician do? repair ends of the tendon torns by suturing. He will do the suture. And if needed, graft or transfer. When we'll do tendon graft and tendon transfer. So if the gap is excess, if the gap is excess between the two ends of the tendon, then the tendon graft will be done. Okay. And if the movement function loss, if the loss in the tendon were present, if the movement loss, then physician will do tendon transfer. Okay. After that, he will close the skin by suture or the staple, and the cast or splint will be done. And to restore the movement, rehabilitation, physiotherapy will be done. So this is simple. Now next. So before going to coding the ICD or CPT, we need to know the basic anatomy of the tendon repair. Okay. So previously discussed, tendon is an fibrous connective tissue that connects the muscle to bone. So there are types of tendon. So there are two types of tendon, flexor tendon and the extensor tendon. So what is flexor tendon? So flexor means the front side of the hand or palm or the forearm. As we see, the bending of the joint is present. So if we open our hand, just example take, if we open our hand, okay, and if we just close our palm, just close our finger, then what will happen? This activity is known as flexor, and this action, that is flexion, is due to tendon. So that's why it's known as flexor tendon. It is present in the upper limb, anterior front side of the forearm, wrist and the hand, and their function is flexion of the joint. So example, like in the hand there is an FDS, FDP, FPL, foot, FDL, FSHL of the foot. We'll see here. Here's an hand. There's a three tendon in the hand which is present. Example, flexor distorum superficialis. Okay, it is present. You can see in the wrist area. Or flexor pollicis longus and the flexor distorum profundus. And in the leg, there is a green part, that is an flexor distorum longus, and the blue part, that is known as flexor hallucis longus. So these are the flexor tendon in the hand and the foot. Okay, so here what is written? Located on the palmar foot side of the hand, flexion bending of the finger, main tendon, and FDS, that is in flexor distorum superficialis, flexes the PIP joint. So what is PIP joint? Where it is present? So it is in proximal interphalangeal. So in the finger, what is the structure? There is an proximal, medial, middle, and the distal. So in the proximal region, if the PIP joint get flexes, then it is due to the FDS tendon. Okay. And if the DIP joint, that is an distal interphalangeal joint, flexes due to which tendon? Flexor distorum profundus. You can feel that. For example, open your hand and just bend your finger, any finger, bend your like index finger. If you just feel, there will be, you feel something here in your wrist area, that known as the flexor distorum superficialis. And if you're something normal, just you can bend your finger, then it's an flexor distorum profundus. Okay. Similarly, in the leg also, um, that is flexor distorum longus and the flexor hallucis longus. Okay. Now coming to extensor tendon. So extensor tendon is present on the back side of the hand. What is the function? Extension, straightening of the finger. Okay. So it is present in the upper limb, posterior backside of the forearm, wrist and the hand, and the lower limb, anterior side of the leg and the dorsum of the foot. And the function is extension. So in the flexor tendon, there is an flexion, there is an bending, and if we straight our the finger, That straightening action is known as extension. Okay. So in the hand, extensor distorum, extensor pollicis longus, and in the foot, that is extensor distorum longus and the extensor hallucis longus. You can see that. So located on the flexor tendon, located on the back side of the hand, and their function is extension, that is straightening of the finger. And in the extensor tendon, that is an important part is central slip and the lateral band. So that central slip extends the PIP joint, that is proximal interphalangeal joint, this one, and the lateral band that extend the DIP joint, that is a distal interphalangeal joint. Okay, so here is an you can see the structures. Okay, so central slip, lateral, and the extensor distorum, extensor indicus tendon, extensor disti minimi tendon, and the extensor pollicis longus tendon. Now, in the foot region, you can see that extensor distorum longus and the extensor distorum brevis. Now, structures of tendon. Okay, so here you can see that the tendon fiber, here collagen fibers here is written. So, endotendon, that is and surrounds the individual tendon fiber. Okay, that endotendon individually surrounds the collagen fibers, and the epitendon that surrounds the whole tendon. Okay, and the paratendon, that is an outer layer for the gliding. Okay, and these layers are important for the healing and the blood supply. Okay, so basically this is a simple structure. Now, so as we previously seen that the tendon, sheath and pulley system. So so here is a tendon that is in connecting the bone to muscle. Okay, and the outer covering of the tendon is known as tendon sheath, that is an fluid filled, and their outer surrounding covering, that is an synovial covering, that reduces the pulley system, keeps the tendon close to bone, that is an A2 pulley and the A4 pulley. Okay, so these are the pulley. Outer side of the tendon sheath is known as pulley. Okay, and here's a cross like a cruciate pulley. So simple. Next. So the topic is flexor tendon zones 1 to 5. So what are these zones and why we need to study that zones? What is the reason behind to study that zones? So one person whose name is Sterling Bunnell. I'll show you pic. Sterling Bunnell. Sterling Bunnell. So this person. Okay. So he is a person, that is Sterling Bunnell, who give the complex structure, complex. Okay. So, so that person, what that person done? Why he give the zones? What is the reason behind to give that zone? So flexor tendon zones are classified the system of the hands and the forearm used to describe the location of the tendon injury. Okay, if person having injury in the hand, then how will physician describe that? How that physician describe that part where is an injury will be there? So that to make the easy to describe the location of the tendon injury, that zones has been classified by the Sterling Bunnell. So there is 5 zones in the flexor tendon. Zone 1, you can see in the pic, zone 1, that is in the fingertip area. Okay, distal phalanx. Okay, so this tendon present in the flexor distorum profundus only, and function is to flexes the DIP joint, that is the distal interphalangeal joint. And zone 2, that is the where is it located? From the middle phalanx to the distal palm. Here is an hole is in palm, and there this is a distal palm, and from the distal palm to the middle phalanx is the zone 2 area. And just this zone 2 area is also known as no man's land. Why? Because this area is very difficult to repair. There will be a high risk of adhesion formation and can affect the finger movement. That's why it's known as the no man land. Okay, that is a third area, that is the palm area. Okay, and the fourth is, which area is this? This is an uh, carpal tunnel. Okay, carpal area. And zone 5 is the wrist area, forearm. Okay, so basically you have to know that the zones, where are the zones present. Okay, and zone 2 contains the FDP and the FDS tendon. Okay, now coming to extensor tendon. So there is 8 zones in the extensor tendon. Okay, so the location, here you can see that the zone 1, zone 2, zone. So backside of the hand there is an 8 zones. So in the zone 1, location is DIP joint. What is DIP joint? That is distal interphalangeal joint. Zone 2 is an middle phalanx. Okay, middle phalanx you can see here. And the zone 3, what is zone 3? PIP joint. That is an proximal interphalangeal joint. And the zone 4, that is an proximal phalanx. And the zone 5 is an metacarpophalangeal joint. And the zone 6, that is the dorsum of the hand. Okay, and the zone 7 is wrist area, extensor reticulum. Okay, and the zone 8, that is distal forearm. So these zones are very much important while coding. Okay, so what were the ICD and what are the CPTs? So ICD codes depend upon the which type of injury is there, whether the rupture is there, whether it is an laceration, and after that the location is very much important, whether it is on foot, finger or hand, and after that the laterality. So example, that is an laceration of the extensor tendon, right index finger. So I'll show you the navigation of that ICD. Okay, so navigation. Oh, sorry. The age of the patient. So it's an laceration. Laceration will spell the tendon. Tendon. Which type of tendon is? Extensor tendon. Extensor tendon. And then extensor tendon, which reason is this? Whether it is a finger, forearm, which reason? That's an right index finger. Okay. So in the finger, that is an thumb, wrist or hand level. Okay. Hand level. So it's an right, na? It's an right index. Right. Initial will take, do not wish to code more. No, no laceration, no associated wound infection, not wish to code more. So this one is an ICD. That is laceration of extensor muscle fascia or tendon of the right thumb at the wrist and the hand level. Initial encounter. Okay. So this is an ICD navigation. Oh, in after the ICD, we'll see the CPTs of the tendon repair. So that CPTs, these are the screenshot of the CPTs of the tendon repair. Okay, and CPT depends upon the flexor versus extensor zone. Sometimes the primary and the secondary repair. And the primary repair of the hand, flexor hand, secondary repair of the hand, flexor or extensor. Based on this, we have to. So here you can see that the 26350, that is repair or the advancement of the flexor tendon not in zone 2. Distal flexor tendon sits no man lands. Okay, primary or secondary without a free graft. So this is an repair of the flexor tendon. And similarly here you can see also see that repair of the extensor tendon. Okay, so these are the CPT codes which is present. And now extensor tendon. Extensor tendon repair, that is an here repair of extensor tendon of the leg. So it is an this one is an finger and hand. Okay, hand region, that is 26350, 26356, that is repair in the zone 2, in the zone 3, that is 57, and the secondary repair of the hand, that is an this one is repair primary, and this one is in secondary, that is secondary repair 26358, 26370, tendon advancement, that is 26340. Okay, so here is an extensor tendon repair of the hand. So hand you can already see in the foot area, that is an leg area, foot or ankle, 27664, 27665, 27675. So these are the CPT's related code. Okay, in the here you can see that in the repair of the primary open or percutaneous ruptured Achilles tendon. Okay, for the Achilles tendon 27650. With the graft is using, we'll see in the another next video with the graft and without a graft. So here is a secondary repair. Here it is in primary and the secondary repair. So what is the difference in primary and secondary? If the patient come for the first time, that it will be the primary. If patient is coming for the second time, then it will be the secondary repair. You can see that the repair of the flexor tendon of the foot is an primary or the secondary without the free graft or each tendon 28200, and secondary graft with the graft each tendon, and 28208, that is repair of the extensor foot. Okay, so we have to see the location, and we have to see the primary, secondary, and the flexor or extensor with the graft and without the graft. So what will physician do in the tendon repair? We already studied that. So first evaluation, once more, first evaluation will be there, that he will find the injury, whether it is a rupture or laceration, access the area, that is in flexor versus extensor, and the which zone has been injured, physician will see that, and the nerve or the vessel involvement. After that, the physician will give anesthesia, incision will be done, and the identifying the torn tendon ends, and then the repair will be done by using suturing, and then check the movement for the gliding of the tendon, and the closure has been done, and the after that the physician will apply the splint and the rehabilitation will be given. So along with the tendon repair there is a note. What is the note? Along with the tendon repair, we do not have to code the simple repair, irrigation, and the exploration wound CPT code, and the multiple tendon used. Multiple tendon repair code should be used along with the 51 modifier as per the documentation. So I will show you the tendon repair example, one OP report. So here's a pre-operative report, that is a diagnosis is flexor tendon laceration of the right index finger. Okay, and the post-operative diagnosis also same, and the procedure performed is primary repair of the flexor tendon. Okay, so operative report, what it say? The patient was placed in supine position in the and the right hand was prepped and wrapped in the sterile fashion, and the anesthesia is given administered, and the incision was made over the injured area, that is a flexor tendon was identified that found to be lacerated. Okay, and the tendon ends were freshened, and the primary repair was performed using non-absorbable sutures, and the proper alignment and tension were maintained, and the tendon continuity was restored, and gliding was achieved, and hemostasis was achieved, and the wound was irrigated and closed in layers, and the sterile dressing was applied. So I will show you the navigation. First diagnosis is flexor tendon laceration. So again we'll add the laceration. flexor, oh sorry, tendon, na? Tendon, it's an flexor. And what is the reason? Right index finger. Okay, so it's an finger reason, index finger, right initial. So this one is S66120. Okay, no, it's code will be different. I think code will be something different. So it's an thumb or index fingers, na, fingers and forearm label. Okay, index finger, right side, initial, not wish to go. No will spell no, no laceration. So this one, laceration of the flexor muscle, fascia and tendon, right index fingers at the forearm level. So this one is the ICD. And what were the procedures they performed? That is in primary repair. You can see here, primary repair was performed of the flexor tendon. Okay, so repair tendon. So it's an primary repair of the, what one is given? Flexor tendon. Site of the tendon repair. What are the site? Index finger, hand and finger, flexor, na? That one is flexor tendon. Okay, flexor tendon, primary, it's primary as we see here. No another tendons will be there. So 26350. Okay, so this one is the repair of the, so which hand? Right. So we'll give the modifier right, like that. Okay, now coming to next topic, that is an 65 number slide. So these are the tendon repair CPT codes, that is for the wrist or the forearm, and the with the graft or without graft is there. So we'll study the tendon related procedure CPT also. So we have already covered the tendon sheath procedure in my previous video, you can see. And so we'll discuss the tendon lengthening, tendon transfer, tendon graft, and the tenolysis and the tenodesis. Okay. So the tendon lengthening, shortening, and release. So what is the tendon lengthening? So tendon lengthening is a surgical procedure where the tendon is lengthened to reduce the tightness and the improvement of the joint movement. Okay. So if there is a problem in the joint movement, there will be a tightness. So it will reduced. How? By lengthening a tendon. Okay. So that one is known as tendon lengthening. Now tendon shortening. When the tendon is very much loose, or to improve the strength and stability, a tendon get tight or shortened. That is known as the tendon shortening. And what is tendon release? Tendon release is another name is tenotomy. So if a procedure where the tendon is cut partially or to completely to relieve the contracture or deformity. Okay, if there will be a deformity in the tendon, so to that relieve that contracture or deformity, the tendon will be cut. So that cut tendon is known as the tendon release procedure. So why tendon lengthening will be done? For the tendon contracture, for the deformities like the club foot, you can see here in the club foot, and some cerebral palsy, trigger finger, tight Achilles tendon, and the restricted range of the motion. So that is the reason for the tendon lengthening, shortening, and release. What will physician do? So the physician will first evaluate the area. After that, the anesthesia is given, and the incision will be there, and the surgical technique like the tendon lengthening. So tendon lengthening, how it's performed using an Z-plasty technique. Tendon is cut and lengthened. So what is Z-plasty? Physician will cut the tendon and make that tendon in the Z position. So that is known as the tendon lengthening. That is the performed in the Z-plastic technique. Okay. And the shortening, what is shortening? A portion of tendon is removed, ends are sutured to tighten. Okay, so basically tightening, there will be some part of the tendon has been removed and the end of the tendons has been sutured and makes the tendon tight. That is a shortening of the tendon. And the release, that is tenotomy, that is a tendon is partially cut or the completely cut. And after that, the closure has been done and the rehabilitation has been done. Okay. So the ICD, we already seen that the M67 series Achilles tendon contracture. Okay, so these are the some screenshot of the lengthening tendon, lengthening, shortening, and the tenotomy procedure. So here you can say 25280, lengthening or shortening of the flexor or extensor tendon, forearm or the wrist single each tendon. Here's in 25290, that is stenotomy, open flexor or extensor tendon, forearm and the wrist single each tendon. Here's in tenotomy of the Achilles tendon, that is an tenotomy, percutaneous Achilles tendon. Separate procedure, local anesthesia and the general anesthesia, 27605, 27606. Tenotomy, lengthening, release, abductor hallucis muscle, that is in 28240. And here is an lengthening and shortening of the leg and the ankle, that is 27685. And for the multiple tendon through same incision each, that is 27686. And here is an tenotomy, that is an of the foot, single tendon, multiple tendon, and tenotomy of the extensor, antenatomy of the toe, percutaneous, multiple tendons. So we have to see all these. Okay. Now we'll see one example, that is an OP report of the. So here is an pre-operative diagnosis: right ankle equinus deformity due to the tight Achilles tendon. Okay. And the pre-operative diagnosis, that is the same as pre-operative. And the anesthesia is general or the regional anesthesia. Operative technique, the patient was brought to operating room and placed in the prone position, and the right lower extremity was prepped and wrapped in the sterile fashion, and the longitudinal incision was made over the posterior aspect of the ankle, and the dissection was carried down carefully to expose the Achilles tendon, and the tendon was found to be tight and contracted. So there is a contracture in the right uh, ankle. Okay, and the Z-plasty. So Z-plasty lengthening, what we see, there will be a Z-plasty procedure. So Z-plasty, there is a tendon lengthening, and the tendon was inside in the Z fashion. The ends were mobilized, and the result in the increased tendon length. And the tendon was then sutured in the lengthened position using non-absorbable sutures, and the adequate correction of the ankle dorsiflexion was confirmed intraoperatively. The wound was irrigated thoroughly and the close in the layers, and the sterile dressing was applied, and the limb was immobilized in the neutral slide dorsiflexion position. So we'll see the navigation. Okay, so here you can see that how we navigate. There is a right ankle equinus deformity, and here in the middle, that is a contracture. So right ankle contracture will be there. Contracture. Contracture of the ankle. Ankle. Right ankle. Not wish to code more. So here is an ICD for the contracture right ankle M24571, and the CPT will be the tendon lengthening. Okay, lengthening of the tendon of the ankle. So in the ankle, what we take? Ankle, lower leg ankle. It's an not an gastrocnemius tendon. It's another specified single only. Okay, 27685. 27685. Okay, and we'll append the modifier, that is an right side. Okay, so this one is the lengthening shortening tendon, lower leg single tendon. So this is an navigation of the tendon procedure shortening. Now we'll see the next procedure, that is an tendon transfer. Okay, tendon transfer. So we have already covered tendon transfer. Tendon transfer. So what is tendon transfer? So tendon transfer is an basically a surgical procedure where the working tendon is moved from the original place to a new location to restore the lost movement. Simply, we can say that a healthy tendon is used to replace the function of the damaged or the non-working tendon muscle. So name here is the transfer. There will be a tendon transfer. So the one working tendon has been moved to one place to another place. So that another place will be the damaged non-working tendon. So simply that is tendon transfer. It is done to restore the function of where the muscle is not working. And the common reason you can say that the nerve injury, tendon rupture, paralysis, deformities, and arthritis. So in the tendon transfer, what physician do? Physician will make an incision. Here you can see that incision. Physician will make incision, identifying the donor or working tendon. Okay. After identifying the donor working tendon, that tendon should be detached from the original insertion and then reroute to the new location. Okay, and attached to the another tendon or bone where the non-tendon working is there. Okay, and adjust the tendon in the proper movement and closes the wound and applies the cast and splint, and the rehabilitation will be provided sometimes. Okay, so the types will be the upper limb, that is in hand tendon transfer, wrist transfer, and the lower limb foot drop correction, and the shoulder muscle transfer for stability. Okay. So there will be the ICD. There is no specific ICD for the tendon transfer. We'll code for the underlying condition. Okay. So for example, nerve injury, radial, ulnar nerve injury, tendon rupture. So there is a no specific tendon transfer ICD. So only the underlying condition, whatever the condition present, that we have to write that ICD. CPT is like the tendon transfer single hand 26480, 26483, 26485 open splasty, and the 25310 to 25312 forearm and wrist transfer. For the lower extremity, 27690 to 27692 deep tendon transfer, and the 27691 posterior tibial transfer, upper extremity 25310, and the multiple tendon 25312. For the shoulder or arm muscle transfer will be 23395. So what is the coding guidelines for the transfer. Do not confuse with the tendon repair versus the tendon transfer. Okay, repair is something different and transfer is something different. So choose the code based on the location, based on the number of tendons, and do not code the incision and exploration code along with the tendon repair. Use the modifier appropriate as per the needs, as per the documentation. Okay. So here is an tendon transfer CPT code, that is 276902761 deep. Here is an superficial, so skin level and the deep level. Okay, tendon transfer, and each tendon additional tendon CPT code. And here is an 25310 tendon transplantation or the transfer of flexor or extensor forearm level with the graft, and the muscle transfer of soldier, single or multiple. Keywords should be the tendon rerouted. In the tendon transfer, when we see the OP report, then there will be keyword what we need to know. There will be a tendon rerouted, tendon redirected, transferred, tunnel has been created, reattached, passed through the intraosseous membrane, subcutaneous tunnel. Okay, so these are the keywords when we do in the tendon transfer. Okay, so let's see the OP report for the tendon transfer. Okay, so here is an preoperative diagnosis. What is foot drop of the right foot. Okay, and the post-operative same, and the procedure performed was posterior tibial tendon transfer. Okay, so in the tibial posterior region, tendon transfer has been done. Operative report. The patient was placed in supine position and the lower right limb was prepped and wrapped in sterile fashion, and the anesthesia was administered, and the incision was made over the posterior tibial tendon. Reason is posterior tibial tendon, and the tendon was identified, isolated, detached from its insertion. So here the term detached na, and the subcutaneous tunnel was created to the dorsum of the foot, and the tendon was rerouted and the transferred to the new insertion site. So here then all these key points are present. Okay, and the tendon was secured using sutures used under the appropriate tension, and the proper alignment and the function was checked, and the hemostasis was achieved, and the wound was irrigated and closed in the layers, and the dressing was applied. So here is an all keywords present. First, anesthesia given, incision will be made, and the reason is posterior tibial tendon. Okay, and how we know that it is a tendon transfer? The detached word, something subcutaneous tunnel was created. Okay, and rerouted, transfer. So these are the key points. Now we'll navigate the diagnosis and so foot drop. So simply we'll check the ICD for the foot drop, DROP, drop in the foot, other specified right foot na, not withstood. So M21371. Okay, M21371. What is the CPT? CPT for the tendon transfer. So we'll give the transfer. Okay, TRANS, transfer of the tendon transfer of the which region? Tendon transfer of the posterior tibial. Okay, tibia. So it's in posterior region, na? So here is an anterior tibial extensor. So it's in deep. Okay, only one tendon has been there, so will not. So 27691 simply. Okay. So I'll append the right modifier as per the documentation. Okay, so simply I have shown the these were delete this codes, delete this codes. Okay, so simply I have shown the navigation of the tendon transfer. Okay, so the next topic we'll see the tendon graft. Okay, so tendon graft. Let's see the tendon graft, tendon lengthening, tendon transfer done, tendon graft. So the next topic, that is tendon graft or reconstruction. So what is void tendon graft to be needed? As we already study that there is a transfer and there is a graft. So if the so using a tendon, that is an autograft and allograft, to replace rebuild the damaged tendon. Okay, damaged tendon or ligament structure. So the tendon graft has been done. So what is the tendon graft? Why tendon graft need to be done? For if there is a rupture in the tendon, so all the intent of the procedure will be same. But what the procedure has given, we have to check that. Okay. So complete tear, instability of the loss function, failed previous repair. So tendon graft will be done. So using a tendon autograft from the same person or from the different person, the tendon will be taken to replace the damaged tendon. Okay. So what will physician do in the tendon graft or the reconstruction? First of all, access the tear. Okay. First of all, he will identify the where the tendon has been torn, and he will make the incision and select the graft, whether it may be auto or allograft, and then harvest that tendon and reconstruct the structure and fixes the graft using an anchors or screws and restore this joint stability, and the closure has been done. So the keywords for the tendon graft and reconstruction: graft has been harvested, or some autograft or allograft reconstruction, like some anchor screws has been used, bone tunnel created, graft passed or position, and fixation with the screws and the anchors. Okay, so these are the CPT codes, that is in hand and finger reconstruction, that is 2652, flexor tendon reconstruction hand finger, not in distal flexor sthit, 26358 flexor tendon reconstruction in the finger region, and secondary flexor tendon reconstruction with the free graft using a rod insertion or previous tube, and 26412 for the dorsum of the hand, and the 263420 extensor tendon reconstruction dorsum of the finger, extensor tendon reconstruction central slip, or we can say that the Boutinier deformity, and the 26434, that is an distal insertion of the mallet finger. Now, similarly for the forearm and the reconstruction of the wrist. So here is an these are the codes, and ankle and foot similarly, and so we'll see the tendon uh, graft or reconstruction OP report. So here is an OP report for the tendon graft or reconstruction. So pre-operative diagnosis, that is a chronic Achilles tendon rupture on the right ankle, and the post-operative same procedure performed was Achilles tendon reconstruction with the tendon graft. So OP report is what it's saying in the description. So patient was placed in the prone position of the right lower extremity. So first, what is the location? Right lower extremity. Right lower extremity was prepped and wrapped in the sterile fashion, and the anesthesia is provided, and longitudinal incision was made in the posterior aspect of the ankle. So its location is lower extremity ankle. Incision weight, and the ruptured Achilles tendon was identified and noted, retracted, poor tissue quality. And due to chronic changes, primary repair was not feasible, and the tendon graft was prepped and using a bridge of the defect and the reconstruct the Achilles tendon, and the graft was secured to the proximal or distal tendon ends using strong non-absorbable sutures, and the adequate tension and alignments were achieved, and the repair was reinforced, and the ankle movement was checked. So immobilization was applied. So here is an incision made, rupture in the Achilles tendon, primary repair, and the reconstruct the Achilles tendon graft and to the proximal and distal tendon ends, and suture had been applied. So you'll see the navigation. So navigation will see the chronic Achilles tendon rupture. So we'll navigate rupture, tendon Achilles tendon. It's on right side, na? Right side of the right side. Initial, not wish to code more. So this is an ICD code for the Achilles tendon. Okay, it's 86011A. And now coming to the OP report, operative, that is in procedure, Achilles tendon reconstruction with tendon graft. So we'll navigate with the reconstruction. Reconstruction of the tendon. Transfer has been not, it's an implant. Other specified Achilles tendon. So graft has been done there, and end to end Achilles tendon primary repair, tendon graft 27652. It's in 54 showing no mention tendon graft 27650. 27654, because repair is secondary. Primary was not feasible, na? So it's an secondary repair. Okay. So primary repair was not feasible. Okay. Here you can see that. Not feasible. That's why we have taken the secondary repair. Okay. So now next that is stenolysis. Okay. We'll continue. What is stenolysis? Stenolysis, that is an adhesion removal. Okay, so here is an adhesion and it should be removed. So basically a surgical release of the adhesion around the tendon to restore the movement, freeing the stuck tendon. You can see if the tendon has been stuck due to the adhesion present around the tendon. So that's why the movement has been stuck. To restore that movement, that tendon should be released. Okay, so tendon should be freeing. So why it's done? When the tendon gets stuck due to the adhesion or the scar tissue or due to the trauma or injury, so that's why the it should be removed. Okay. So what will physician do? Physician will simply incise that area, tendon should be identified, and the adhesion carefully released, and the tendon freed from the surrounding tissue, and movement has been checked, and the wound has been irrigated, and closure has been done. Okay, so simply the M67 series has been the ICD code, and the N2560, that is joint addition stiffness. So is an CPT code for the some tenolysis, that is an tendon should be adhesion removal. Okay, so 26440, that is stenolysis of the flexor tendon. So every, you can see that now we have to identify the location. Finger, ankle, and after identify the location, we have to check the flexor or the extensor. Okay. After that, we have to check whether it is stenolysis, tendon graft, tendon transfer, or repair. So we have to check all these things. So it is an tenolysis, complex extensor tendon of the finger, including forearm, each tendon. So these are the CPT codes for the tenolysis. So you'll see the OP report for the tendon adhesion. Okay, tenolysis of the flexor tendon. So here, so operative report saying pre-operative is in flexor tendon adhesion, right index finger. Okay, and the post-operative diagnosis same. Procedure performed is stenolysis of the flexor tendon. So we'll see the description. So the patient was placed in the supine position, and the right hand was prepped and wrapped, and a small incision was made over the flexor aspect of the index finger, and the tendon was identified, and the dense tendon and adhesion was noticed. Okay, dense adhesion was noted, and the careful tenolysis is the direct tenolysis performed, and the releasing the adhesion and freeing the tendon from the surrounding scar tissue. And the tendon gliding was checked, found to be improved, and hemostasis was achieved, and the wound was closed in layer, and the sterile dressing was applied. So we'll navigate these. So here's an adhesion of the flexor tendon, adhesion of the tendon. Back. And then adhesion of the flexor tendon, right index finger. So it's an and M65841. It's an M67. Forearm, hand reason we can take na right side. M65841. So it's an wrong swing. Why? Forearm, foot, ankle, thigh, upper arm, other specified and specified. Upper arm, right side. So it's in right upper arm. Okay. 843. It's in wrong. Why it's coming wrong? Back. Addition of the tendon. So it's in hand level only. Okay. We'll see that the 65841. M67 847. M67 847. Okay, so this one is not available. So this one is the our right code. Okay, M65841. And now the procedure, that is stenolysis of flexor tendon. Okay, stenolysis. Stenolysis of the flexor tendon. So what is the reason? Reason is right index finger. So it's an hand reason. Hand reason and the flexor tendon. Na? Flexor tendon, right index finger. Flexor tendon of the finger or. Okay. So why we have taken finger or palm or finger? Because it's an one reason. If both reason are present, then we have to take both reason. Okay. Because and it means both. But here is an one only. Na? That's why we have taken that one. Okay. So 26440 is an CPT code for the flexor tendon, tenolysis of flexor tendon. Okay. Next, we'll see we have seen that. Now, tenodesis. So, what is tenodesis? Here is an tenodesis. What is tenodesis? Why needs to be tenodesis? What is? So, it's an surgical fixation, that is an anchoring of the tendon to bone. So, surgical fixation of the tendon to bone is an tenodesis. Okay. So it is due to the tendon instability by tendon rupture or degeneration or slap lesion or failed previous. So it should be fixation. Okay, anchoring of the tendon to bone. So what a physician will do? Physician will first, if there is an incision, then physician will identify whether it is an arthroscopy or incision. And after that, physician will identify the tendon, whether it is an commonly the bicep tendons, and the tendon detached from the original site, and the new fixation site has been prepared, and the tendon and anchor had been used, like the suture, anchors, or screw, and the stability has been checked, and the closure has been done. Okay, so ICD like M75 bicipital tendinitis, S46 to XXA, that's an injury of the bicep tendon, M67, and this CPT like this soldier 234 through 30, and it's an open means in season, and here's an arthroscopic bicep, that is an scope has been entered. Okay, so here's an OP report of the tenodesis. So preoperative diagnosis is the biceps tendinitis, that is right shoulder, and post-operative same, and the procedure performed is biceps tenodesis. And OP report in description: the patient was placed in supine position, and the right shoulder was prepped and wrapped in the sterile fashion, and arthroscopy was performed. So here arthroscopy, not incision, has been made. Only arthroscopy was performed, and the long head of the bicep tendon was identified, and the tendon was released from the origin and anchored. First released from the origin and anchored to the humerus using a sutures anchor, and proper tension was maintained and fixation was confirmed, and the wound has been irrigated and closed, and dressing was applied. So let's see the uh, navigation. So it's an bicep tendinitis, right shoulder tendinitis. So it's in bicipital right, not which to code more. So M75 21 is in bicipital tendinitis, right shoulder, and the procedure is what? Procedure is biceps tenodesis. So tenodesis, biceps tendon at the shoulder. So it's an shoulder, arthroscopic biceps. Okay. So it's on right side. So 29828. So this is the code for the biceps tenodesis arthroscopic. And in the next, that is an so this one is the tendon transfer, tendon graft, and what you say? We have all completed the tendon repair topic. Okay, we have completed the tendon repair. So now in the next video, we'll continue the manipulation, amputation procedures, and after that the bunion procedure, hammer toe, and the next stenotomy and all this procedure. So one by one. So today tendon topic has been completed. So please guys like and subscribe my channel.